Hey everyone, welcome back to Tuesday Tea. Thank you so much for joining in with us this week. We have a dear friend and colleague, Nikki. I've known her for so many years, way too many to count. We graduated actually back from Columbia together. So it's been a journey, but I'm so thankful that we've been able to keep in touch. And she is doing some incredible work um, as a therapist and in some other arenas that she's going to share with us shortly. But I really brought her on today to kind of continue this conversation about mind and body, and especially how when our bodies are doing what they're doing or acting up or um, we're not feeling totally whole, how that also can impact how we are thinking and our emotions as well. So we're going to dive a bit into her own personal journey of endometriosis. First, I want to give her a chance to introduce herself and say hello, and thanks so much for being here.
Thank you, Alisha. And we've known each other for 15 years, is what I was able to calculate, which is weird to say.
Math is hard to do on our own, so I appreciate the help.
Yeah, no, it doesn't feel like 15 years. And we're so youthful.
No, we are.
So I'm Nikki Tennerman. I'm a licensed clinical social worker like Alisha. I work in healthcare. I've worked in healthcare for now a long time. I also have a private practice where in the greater Boston area, where I work with adults who identify as BIPOC or LGBTQ. And in healthcare, I work particularly around thinking about advancing health equity. So making sure that everybody has the best health outcomes possible.
I love it. And I'm so thankful that you're going to be able to be a little vulnerable and share a little bit of your own personal journey with us today. I know this is a topic I feel passionately about just because I have loved ones who also are diagnosed and struggle with the impact of endometriosis. But for folks who just might not be as aware or like heard the word but don't know, could you give us maybe a little bit of just like some education on what this is? And then even just share a little bit of your own story of sort of some of the big takeaways of your own journey and kind of where you're at
Yeah,
today.
happy to. So endometriosis is a chronic, permanent medical condition of the reproductive organs. It's where, although it's not limited to the reproductive organs, so it's where tissue that is similar to the lining of the uterus grows not in the uterus. So it grows in places where it shouldn't be, but it still very much functions similar to the lining of the uterus. So when you think about a menstrual cycle, it will swell and bleed in and cause discomfort throughout one's body. So it's systemic. And it is very much associated with hormonal changes throughout like a monthly cycle. Depends on every person is different.
Mhm.
1 in 10 women or people with uteruses have endometriosis. So it's actually really common. I believe I've read that that's the same like percentage of people who have diabetes. So it's really, we hear all the time about diabetes, but
Wow.
we don't
Yeah.
hear, maybe we hear more and more about endometriosis now. There was a documentary, Below the Belt, that came out through PBS a couple of years ago. So there's more, I think, understanding and conversation about. That's why I'm so open about it, because I was one of those women who didn't know what it was. And I thought it was like, oh, women who can't handle their period pain. Oh, right. Like
Right. Right.
very much how we condition girls and women to behave with when, don't, it's not a
Yeah.
big deal. You should keep working. Just,
Yeah.
it's,
Yeah.
when actually no, endometriosis can affect your whole body. So I know people, it can grow on your diaphragm. It can grow, it can affect your ovaries. It can affect your intestines. It can affect the inside of your stomach lining. And it's associated with chronic pain, really painful, heavy periods, infertility. And there's no cure. The treatment for it is birth control, and you take it continuously. So you no longer menstruate, because that's menstruation makes it kind of worse. Every time you have a
Right.
cycle, you build up
There's
more
that.
blood.
Mhm.
Exactly. It flares. Although we'll get into mind body connection, but when we think about flaring, it functions really, I don't know if it's considered an autoinflammatory condition, but it very much functions similar to an autoinflammatory condition, where if you're stressed, if you're if you're have a lot going on, it can get worse.
Right. Right.
And so it's a pretty debilitating condition, and it's
Mhm.
because it's not well understood. It is absolutely underdiagnosed. Same thing, statistic I've read, on average, it takes 7 to 10 years for a woman to be diagnosed with endometriosis. We know that certain subsets of women, Black women, are less likely, like that's even longer of a
Right.
diagnosis for
Right.
them.
That's if you have access to healthcare, are advocating for that health access, like speak, know what to even say, know how to
Have a
and
provider who believes you, all of that.
right. It's there's so many layers of privilege and other things that have to happen, right? It sounds like to even get this diagnosis, which is
Exactly.
wild. So
Yeah, and I certainly fell into that category. I was not, while I have since learned that there are other women in my, not in my immediate family, but in my extended family who do have endometriosis, it was a surprise diagnosis for me that I got in my 30s. Looking back with the knowledge now that I have it, I see what were signs of it, where I did have painful periods in high school, but I took birth control continuously because you could do that back then. And
oh
girls
yeah,
were like,
yeah.
hey, did you know you can take it continuously? And in the end,
Right,
I was treating my endometriosis, but I didn't realize that.
right, right.
Um, and then having what began in actually when we, around the time that we were in New York City, when we moved for Columbia, is when I started having symptoms and I had ultrasounds. Unfortunately, endometriosis, the only way to confirm an endometriosis diagnosis is through surgery. Yeah.
Mhm.
You can see it on imaging if you grow certain types of lesions, like if you have an endometrioma, which is a cyst on your ovary. That's how it was ultimately diagnosed for me. But those, you have to get an ultrasound, again, talking about access. And so some people don't get endometriomas. They just will have lesions inside, of their abdomen.
Right.
And you can't see those
Thank
on
you.
ultrasound. Doctors are reticent to give you surgery if you're like, I think this is it.
Right, right,
So I had ultrasounds over years and had pain, and it was misdiagnosed as GI issues, and then I had to control my diet. And then as I got older, my uh, period bleeding and pain got much worse, and my stomach would swell. I would like look pregnant, and I thought that was the COVID shot because that was the times we were in. And then ultimately, it got to the point where I couldn't stop vomiting with my period, which feels very extreme, but it would get to the point, like
yeah,
even where I was on a call one time and I had to log off of the call because I had to go throw up in the toilet, like yikes. And I talked to my doctor about it, my GYN, and I was like, is this just age? Like, am I just getting older? She's like, it could be fibroids. She was like, let's do an ultrasound. And I was like, are you sure? She was like,
yeah,
yeah. So we did the ultrasound, and actually it turned out to be endometriosis. And then obviously I had surgery and, really changed things after that.
yeah, yeah. It's just like even knowing what I know, more limited, but just again talking about here, it's just like wild how pervasive one word, one diagnosis, like how much of your whole system and your functioning this one thing can like wreak havoc on, right? So I imagine that while physically that's so much to keep up with and negotiate and figure out without the promise of like take this pill and you'll be cured forever. So, right. So just knowing it's not necessarily going away, but maybe there are hopefully ways you can be a little bit more tolerable or whatever else. But how else has this really impacted you just like emotionally, mentally? Because that's a lot to keep up with, I imagine. Just hearing it, right? Like it's not just like one thing I have to negotiate. That's like 1,000 different things that it's hitting on. So how has that sort of hit you most? And then what are some ways that you're learning how to take care of yourself mentally and emotionally as well, in addition to just the physical aspects of this diagnosis?
Mm-hmm. So certainly in some hand, it was a relief
Hmm.
because to be experiencing, like, again, to be pooping blood is like not normal. And then to have a normal colonoscopy, which is also common in women, in people with endometriosis, it's confusing. And you're like, and to know, to feel like I have a connection enough with my body to have known that something was going on for so long and to have it not be identified, it was valuable to get a diagnosis. And it clicked for symptoms that I was experiencing, where I would be trying to say, well, what was that one thing that I ate that's now affecting my bowels? Actually, it's not. It's related to inflammation. It's related to my menstrual cycle. It's related
Right.
to other things, right?
Bigger thing. It's not just
Yes.
these
It's
little
not just like I had
things you're
coleslaw
chasing.
and now my
Right.
stomach
Right.
hurts,
Right. Right.
right?
Right.
Which is what I had been told. Is like, don't eat this, don't eat this, don't eat this, don't eat this. Um, So it was a relief in that way, and it made the symptoms more understanding, and it made me be, certainly when I think about my mind and coping, it made me go easier on myself. It made me more likely to say, let me take medicine for this. Like, no, I don't need to grit my teeth through this. Like, I should take
Yeah.
some medicine. I should use a heating pad. I should take this afternoon off from work, or I should take this call from my bed with my camera
Right.
off.
Right.
Um, Certainly being diagnosed with a chronic medical condition is life-changing. And I think I'm obviously it's not terminal, so I'm glad, like, right. But to have a permanent condition, as you alluded to, is disappointing. What I have to look forward to is menopause, which nobody looks forward to.
Right. Which comes with its own stuff sometimes. Like,
Exactly.
okay. So, yeah.
And so that to after being diagnosed, to be staring down surgery, like, even my friend, she's a doctor, and I texted her after this, and she was like, well, a quick Google search will tell you that needs to come out. Right. So
Yeah.
to mentally have to accept that I needed surgery, to have to deal with treatment decisions of, do I want to take this medication that also has side effects?
Right.
And then certainly to experience infertility, which I'm blessed that I already had a child. A lot of people are not, because again, there's such a delay in diagnosis, and also symptoms can show up when you're a teenager. You're not thinking about having children when you're a
Yeah.
teenager. So is really upsetting. So all of those, again, it just changes your outlook on what you expected for the future, how you understand your body. Also, I work with people with chronic medical conditions, in my job. But so the idea that, like, your body isn't working the way that you would want can be certainly upsetting. So things that I am blessed to have access to really good medical care, which is a benefit. And so I've had a really great supportive care team, and my doctor is really understanding, where I'm like, oh, I'm worried about this. He's like, well, go see that specialist. And if it's nothing, it's nothing, but get it checked out, because
Yeah.
why would you wait,
Yeah.
So that's been helpful. Certainly, going back to therapy, obviously I'm a therapist, so, like, I believe in therapy, but talking to therapists is very helpful. Spending time nurturing my body, so being thoughtful about spending, I'm not a crazy person about it, because not to say that people are crazy, but I don't go overboard
Right.
with, like, an Ayurvedic or anti-inflammatory lifestyle, because I like things to eat that are not good for me, and I'll suffer through them, but that's a choice I get to
Right.
make.
Right.
But
Right.
doing more, like, incorporating more ginger and turmeric into my lifestyle, taking vitamins, which I didn't used to take, things like that, to take care of my body, paying attention to exercise and stress. All of those are important. I think the biggest kind of mind piece has been certainly around the support network, because it is such a misunderstood condition, that's why I've been so open about it. But trying to get my family to understand, for me, I also have more and more, we realize that I'm very sensitive to the hormonal fluctuations of
Yeah.
endometriosis. And so helping my family look back on ways that I've behaved in the past, and giving me grace to say, like, this is a really serious condition that I've had that really affects my mood.
Right.
And not to give me a pass, but to also
Right.
acknowledge that I'm dealing with something very serious. And yeah, and so I think those have all been ways that I've tried to kind of work through it, make sense of it, and it's an active process for sure.
Yeah. Yeah. I think some of the key things I heard that I want to pull out, just to reiterate, the first being, like, you're not crazy, right? And I think that that is such a validating thing to hear. That sounds like, why would we need to say that? But especially as women, we need to say that.
Yes. You're not
And it
making
could be
it
about a
up.
lot of things, right? Like, it doesn't have to be that this is just this one diagnosis, right? It's like, we do know our bodies. And I think as women, especially, though, we're really groomed to stop trusting our gut, our instincts, physically what we're
Spiritual
feeling.
woman. Yeah.
Mhm. And that is such a disservice for many reasons, but the main one is when it comes to these medical or health conditions or pieces that come up, we say, well, doesn't everyone feel pain at this time of month? Or isn't that just how it is? Or I'm just being extra. I don't want to be too much. And we don't seek help. We don't look for answers. We don't keep fighting or pushing for the support or to be heard or believed as we deserve. And that hurts us to not understand ourselves. It hurts the others in our life who can't also fully understand or know us because we don't even really have the answers of the words. And it might prevent like some care that could have helped even just a little bit along the way, like just names and knowledge and understanding changes so much about an experience. Even if it's still hard, we have a framework for it, right? So I think that's just a good reminder of you're not crazy. If something doesn't feel right, it probably isn't right. And that doesn't always just have to, that could go to lots of situations, but in this case, we're talking about that, the connection to our bodies. And to find the support network or people in your life, if it feels too overwhelming to do alone, who might help you be able to tackle and advocate for yourself, or find those doctors or humans or people that will listen and will provide the tests, the knowledge, the information that you really need, right? I have PMDD, gotten much better, but it flared up, and there was a whole year of my life which is premenstrual dysphoric disorder. So I don't get. I know there can be physical symptoms. I don't get those. I just felt really out of my mind for 3 days before I would bleed. Like watching myself watch myself, and especially as a therapist who like knows what I know, I'm like, what's happening? But I was getting married, I was moving, there was so much going on, and I just kept thinking, well, maybe it's this, maybe it's that. But no, it was something else, right? And I finally had to find a protocol because I had patients actually that had been diagnosed with this and were on Prozac 10 days a month, and it was this great thing that worked for them. And I had to take it to my doctor and say, like, can we try this? Like, and thankfully she was awesome. She listened to me. She did a little research, but she said, let's try it. It was a game changer for me. Right. And then again, not everything is for everyone. This isn't medical advice. Definitely
Well,
talk to
but
your
it's the
doctor
self,
first.
what I feel like what you're endorsing is the self-advocacy piece,
Yeah.
is that you have to keep going and you have to be able to speak up to it. And again, that's easier for certain women, right? We both went to an Ivy League school. We're not glazing over the privilege that we have, but yeah, being able to say, I feel connected to my body. I'm recognizing this doesn't feel right, and keep pushing, keep pushing. And the point you were making too about connections with people, I forgot that I've also, in being open about being diagnosed with endometriosis, I found a lot of other women who have been diagnosed, and that is valuable because I hear from them, what did you do? What do you do? What's your approach? And then also there's a great organization called Endo Black, which is focused on endometriosis that's affecting Black women. And they're just a wealth of reputable like knowledge, because we know in the social media age, there's so much stuff that's out there that's maybe
Yeah.
not high quality. Yeah.
Yeah.
That is like, they're really focused on the science and they're patient advocates. And so I think that's another way, like you're saying, that you can get into certain communities that are really valuable, and you feel not as alone, but also can get really high quality information.
Yeah. And I think that last piece too is just like the grace for yourself and educating others in your life to be able to support you the best way that they can. While no, it's on our job to like always teach people what to do, but sometimes we have to. People can't know what they don't know. And if it's going to help you out, then it's sometimes worth that effort to share or encourage them to do some of their research or to understand you better, whatever that might look like. And I do think that chronic illness, especially invisible ones, are really hard for people to empathize with or understand or remember sometimes if they don't see you all the time or whatever else. And so I think that having that grace for yourself to slow down, to fit your lifestyle around your symptoms, which you can still have a very full life, eat what you want, like pay for it later, but like knowing you're making that choice, you have the power, or to like do what you need to do, but also maybe having those little blurbs or taglines or scripts to remind or gently educate or inform others of how they can also support you at the end of the day for your own self. But I think that can help too, because like you said, stress, our minds do so much directly affect our bodies. And so if we're mad at ourselves, calling ourselves names, telling ourselves we're not good enough, entering high levels of like conflict or that anxiety to the best that we can or can't control it. But if we're allowing all of those cycles to happen in conjunction with this other chronic thing we're dealing with, it's just going to keep making it worse, right? So I think that slowing down, trying to get the support, work with, not against. You have all the feelings you have about the diagnosis you didn't choose, but like also now what can you do with that information? Which sounds like that's what you've been empowering yourself to take back the control that you didn't feel like you really had for all those years when you weren't really clear on what was going on. So
Oh yeah, absolutely. Absolutely.
I love it. Was there anything else that you want to share before we say goodbye that you haven't been able to share, or any other, I don't know, anything you're doing that you want people to know about, or any little tips?
Um, I guess I would just share that if anything, I would encourage folks to learn a little bit about endometriosis, that I think it is so common that you're likely to have somebody in your life who is affected by it. And so I think it's valuable to learn about what is a very, very common condition that again has no cure. And also if you already know about it, then I think the reminder of the grace piece that for any person who experiences menstruation, then I think we need to give more grace to that. I think it's all kinds of all kinds of reproductive health and health justice issues are really front and center right now. And I think continuing to recognize that access to reproductive health care is a human right, and we should not be toying with and meddling in other people's health and their health access needs, because you don't know. And it's been horrifying, some of the things that come out of my body because I have endometriosis. Like, it's shocking that people
Yeah,
have experienced this in more primitive times. Like, no
yeah,
wonder women were dying. And so
yeah,
and it's not even a joke, because there was an African like rap artist who just recently died of endometriosis. So it's a serious condition.
yeah.
So anyway, I just think if you already know about it, great, thank you. I think let's all remember that we move with our feet and with our votes in particular too, when we think about what are we doing to stand up for reproductive health, access, and justice, because it's
Yep.
not, I don't think it's a funny thing. I don't think it's the same healthcare that people feel like is, ideologically they're against, is directly needed for me to treat my chronic medical condition. And so if you're restricting what you feel like is an ideological thing, you're actually limiting not just me, there's other conditions that also need access to these medications. And so
Right.
I take that really seriously.
No, I think that's a great reminder. I think that when it comes to women's bodies and women's health, it's always much more complex than we ever want to talk about it on the surface, or especially in larger arenas. And yes, one ruling or one decision about one little tiny part, which is like babies, which is the tiniest part almost about this whole topic, it has such a trickle down effect to like so many other pieces that have nothing to do with another potential human life in any way, shape, or form. So
Exactly.
I think it's just a good reminder, and the pervasiveness, I think that piece of challenging y'all to educate yourselves on, or at least just like think about this diagnosis, because 1 in 10, wow, like when you said that diabetes thing, it like hit me of like, God, that's like
We talk about diabetes
everybody.
all the time.
You know what
Yeah,
I mean? Like
we
that's
think
all,
about that,
yeah, yeah,
but we don't
yeah.
think about endometriosis.
No. So I appreciate so much you taking your time today and sharing your own personal journey, as well as your infinite knowledge, and just your presence in your space being here today. Thank you guys so much for also tuning in. I'll be with you next month as we're at the end of June here, but I hope you're having a lovely rest of your day, and we'll see you later.